Hi, I'm Dr. Steve Grinstead, author of the book Freedom from Suffering, A Journey of Hope, and someone living with my own chronic pain for a long time now. Today I want to talk about what do we do when our pain flares up and it becomes the whole center of our universe. One of the things I know I've found very effective is to practice a technique I call avoidance by distraction. Now, sometimes distracting ourselves can be a very unhealthy thing. But I'm talking about the type where I want to put my focus on something besides my high levels of pain. I want to do this in a healthy way, though. Avoidance by distraction can be a blessing or a curse. This is one of the tools I find most effective when I'm having to get things done and I have a pain flare-up. There's times when I have a pain flare-up when, if I can, I'm going to take some downtime. But there's times when that's really not readily acceptable to me. Like, for example, when I'm out on the road training or teaching, and there's a lot of people depending upon me being there and being at my top. Well, when that happens, I need to really focus on first things first. The first thing I look at is there something I can be doing that I'm not doing to lower the intensity of the pain? If there is, I'll do it. If there's not, it says, okay, the pain's here. What do I want to focus on more? The pain and how horrible it is, or the event and how exciting it is? So I want to put my attention on something more interesting and positive, something that brings me joy. And one of the things I love most in the whole world is teaching people how to help people and helping end pain and suffering one person at a time. When I'm doing that, I'm at the top of my game. Now, there's been times when I practiced this avoidance by distraction and ended up making my pain worse. So it's learning appropriate pacing. One of the tools I often teach my patients, though, is how to find something more interesting and positive to focus on when you're having a pain flare-up, once you take the precautions you're supposed to take. I do a lot of pain flare-up planning with people, how to develop non-medication based interventions. Of course, sometimes as a last resort, there's an appropriate medication intervention that needs to be implemented. One of the things I do know is I never have to suffer with my pain again. I've been very fortunate. I've been living with pain probably almost 32 years, and now I haven't suffered with my pain for almost 30 years. And I never want to go back to that. And I found that freedom from suffering is a right, but it's also a responsibility. For those of you watching this on YouTube, please go to my personal blog on the link below and learn more about this avoidance by distraction. Thanks.